Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Eating disorders. Introduction. Eating disorders are illnesses that cause serious changes in a person's daily diet. This can include not eating enough food or overeating. Eating disorders affect about 70 million individuals worldwide. The majority of people with an eating disorder are women. Getting help early for an eating disorder is important to prevent complications. Eating disorders can cause serious health problems. This program will help you understand 3 eating disorders: Anorexia Nervosa, Bulimia Nervosa, and Binge-Eating Disorder. It also discusses possible causes, complications, and treatment options for eating disorders. Eating disorders. Eating disorders are a serious medical problem. People with an eating disorder may use food to try to control overwhelming feelings. They may also have obsessions about body weight or shape. Eating disorders are real, treatable medical illnesses. They often develop with other illnesses, such as anxiety, depression, substance abuse, or obsessive behaviors. Often, people with eating disorders feel ashamed and may become depressed. They may avoid their friends and family and miss social events. Eating disorders are serious and can become life-threatening if a person doesn't receive treatment. Some eating disorders can affect the heart, brain, and other important organs. There are 3 common eating disorders: Anorexia Nervosa, Bulimia Nervosa, and Binge-Eating Disorder. The following sections will examine each of these a bit more closely. Anorexia Nervosa. Anorexia nervosa is often just called anorexia. People with anorexia nervosa see themselves as overweight even when they are clearly underweight. Eating, food, and weight control become obsessions. People with anorexia nervosa typically weigh themselves repeatedly, portion food carefully, and eat very small quantities of only certain foods. Some people with anorexia nervosa may also engage in binge eating followed by extreme dieting, excessive exercise, self-induced vomiting, or misuse of drugs that aid in weight loss. A person with anorexia has a low body weight for his or her height, has a strong fear of gaining weight, thinks he or she is fat when in reality he or she is very thin, resists keeping a healthy body weight. People with anorexia look very thin. They may use extreme measures to lose weight, such as exercising when they are tired or until their body hurts, making themselves throw up, not eating or eating very little, taking diet pills. People with anorexia are at higher risk for issues with the heart or brain and problems with physical development. Anorexia affects the whole body because the body isn't getting the energy it needs from food. Anorexia may also lead to anemia, inability to become pregnant or have a baby, low blood pressure and slow pulse. Anorexia may also lead to multi-organ failure, muscle wasting and weakness, osteoporosis or fragile bones.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Bulimia nervosa. Bulimia nervosa is when a person has repeated and frequent episodes of eating large amounts of food and feels a lack of control over these episodes. This binge eating is followed by forced vomiting, excessive use of laxatives or diuretics, fasting, excessive exercise, or a combination of these behaviors. Unlike anorexia nervosa, people with bulimia nervosa usually keep a healthy or normal weight while some are slightly overweight. But like people with anorexia nervosa, they often fear gaining weight, want desperately to lose weight, and are intensely unhappy with their body size and shape. Someone with bulimia may use extreme measures to lose weight by exercising when tired, going to the bathroom right after eating to throw up, using diet pills, diuretics, or laxatives.
Someone with bulimia may also show signs of throwing up a lot, including broken blood vessels in the eyes caused by a person retching and vomiting forcibly, calluses or scrapes on knuckles if using fingers to induce vomiting, swollen cheeks or jaw area, teeth that look clear due to damages from the stomach acid found in vomit.
People with bulimia are at higher risk for issues with the heart or brain and problems with physical development. Bulimia nervosa affects the whole body because the body isn't getting the energy it needs from food. Bulimia can eventually cause digestive system problems like ulcers, electrolyte imbalance which can lead to heart attacks, sensitive and decaying teeth, severe dehydration, binge-eating disorder. People with binge-eating disorder often eat an unusually large amount of food. They commonly feel out of control during these binges. Binge eaters are often overweight or obese. Unlike bulimia or anorexia, binge eaters don't throw up their food and don't exercise a lot.
People with binge-eating disorder may continue to eat after they feel full, eat alone because of embarrassment, eat more quickly than usual during binge episodes, eat when they aren't hungry, feel depressed or guilty after overeating.
The guilt and shame that people with binge-eating disorder experience after an episode often leads to more binge eating.
People with binge-eating disorder are often obese. This raises the risk for certain types of cancer, heart disease, high blood pressure. Obesity can raise the risk for high cholesterol, gallbladder disease, type 2 diabetes.
Causes. Researchers are finding that eating disorders are caused by a complex interaction of genetic, biological, behavioral, psychological, and social factors. Women are more likely than men to have eating disorders. Also, eating disorders usually start during the teenage years. Eating disorders often happen along with other mental problems like depression, anxiety, and obsessive-compulsive disorder. People with eating disorders often feel helpless and worthless. Stressful events or life changes may also affect how healthy a person eats. Traumatic events may lead to the onset of eating disorders. An eating disorder may develop due to family environment as well. A parent's attitude about appearance and diet can affect their children. Also, a person is more likely to develop an eating disorder if someone else in their family has it too. Treatment.
Treatment for eating disorders usually involves a team of nutritionists, therapists, and other healthcare providers. They will help the person to cope with stress and feelings, learn healthy eating patterns.
One goal of treatment is to help bring the person back to a normal weight. Another goal is to treat any psychological issues related to or causing the eating disorder. This is to prevent relapse or getting sick again. Treatment for eating disorders usually involves medicines and psychotherapy. Medicines may include antidepressants, antipsychotics, or mood stabilizers to treat anorexia. Medications that either stimulate or reduce the appetite may be used depending on the eating disorder. There are many different kinds of therapy available to treat eating disorders. Therapy may be done in groups, one-on-one, or even as a family. Nutritional advice is also a part of treating eating disorders. Knowing how to eat healthy is important in maintaining a healthy body weight and image.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Eating disorders are a serious medical problem. People with an eating disorder may use food to feel control over feelings that seem overwhelming. These people may also have obsessions about body weight or shape.
Eating disorders are treatable medical illnesses. Eating disorders are serious and can become life-threatening if a person doesn't receive treatment. Anorexia nervosa is often just called anorexia. People with anorexia nervosa see themselves as overweight even when they are clearly underweight. Eating food and weight control become obsessions. Bulimia nervosa is when a person has repeated and frequent episodes of eating large amounts of food and feels a lack of control over these episodes. This binge eating is followed by forced vomiting, excessive use of laxatives or diuretics, fasting, excessive exercise, or a combination of these behaviors. People with binge eating disorder often eat an unusually large amount of food. They commonly feel out of control during these binges. Binge eaters are often overweight or obese.
Treatment for eating disorders uses a combination of options. These usually involve medicines, therapy, and nutritional advice. Eating disorders can cause serious health problems. Getting help early for an eating disorder is important to prevent complications.
Thank you for using Explain.